Hello everyone, this is my second video and this is a video in which I'm going to tell you the aftermath of the surgery. So I have had a first rib resection and scalenotomy. This is where it happened. So as you can see, it's an incision that has around about a finger in length. And the surgery happened yesterday and I've already been discharged from hospital, which is great news. The reason why I've been discharged from hospital is because I am almost pain-free. I have some areas that are more bothersome than others, and I have certain discomforts. But I've been almost pain-free um, throughout the whole post-operative recovery, and even the nurses and the doctors have been quite surprised about it. And they've been asking me, trying to give me some painkillers, but I had to reject them because I didn't feel any pain. I actually slept really well after the surgery, and the only troublesome times were right after the surgery where I was feeling very nauseous because of the general anesthesia and because I hadn't eaten in 15 hours actually. So slowly as I was able to eat and stuff like that and rested, I was more or less fine. The areas that are a bit that showing a bit of discomfort are still like here, which is where the surgery happened. So I feel a lot of tension here, which especially when I'm standing up is it can be very tiring and so on. So and this is why the next week I'm gonna try to recover from it and see how it goes. This is also affecting like certain movements with the neck, but for that I'm gonna be doing some physiotherapy. So I can move my head this way, so tilt it this way, but I can hardly tilt it the other way. So I'll be working on that in the next few days, and hopefully in the next few weeks I'll be able to regain that range of motion. And as far as it comes to nerve pain, I felt a bit of discomfort on the diaphragm and even pain. Sometimes even when I was breathing right after the surgery, that has sort of resolved itself and it's not there anymore. I haven't felt any pain at all down my arm, and I don't have any weakness in my grip or anything like that, which is one of my what was one of the things I was mostly worried about. Aside of that, the range of motion is also really good. Even my physiotherapist was very surprised about it because she was telling me how in most cases people are not able to raise their arm that much. In when they do like certain exercises, like in this one where you try to push the operated arm as far as possible, most people are only able to get it to the chest. In my case, I can get it all the way up to here, which is like the front of the head. I mean, I cannot extend it even more, but I'm going to be working on that in the next few days and weeks with my physiotherapy. I have been given painkillers, a whole bag worth of it, especially codeine and paracetamol, as well as some sort of like natural herbal remedy, which I'm not too sure what it's supposed to do, but I'll see and I'll take it, whatever. I don't know whether I'm going to need it. And I'm not sure whether I'm going to need it mainly because I still have this area here that is very numb. So the area where the actual surgery has happened is quite numb because aside of the general anesthesia that I received, there was also some local anesthesia that was given as the surgery was being performed. So I still have those effects there. So hopefully in the next few days that will wear off, and as it wears off, fingers crossed, it won't turn into pain and agony. Um, so yeah, I will say I will really encourage people to have the surgery. I'm very happy with it for now. The only thing I will say is I try to have the surgery with someone that has performed the surgery before many times, has experience in this surgery. Had mine done at the Queen Elizabeth Hospital in Birmingham in the UK. It was performed by Professor Vora and his team of surgeons. And Professor Vora is very experienced in this kind of surgeries, and at least from my point of view, he's done an amazing job. And the kind of care that I received from him and his team and nurses at the Ward 517, which is a great ward, it's been fantastic. And I think it has really helped me to be able to recover as well as I have recovered from the surgery itself. So I think that will be it for now. So feel free to ask me any questions. We'll be posting more videos as my recovery goes on and I do all the physiotherapy, and hopefully I'll be able to regain some of that like lost range of motion that I can feel right now. Hopefully this whole tense area will dissipate with time. And yeah, I'm really looking forward to seeing what happens. And I'm really happy with the outcome of it. I haven't said it yet. I might make a video saying it, but the thoracic outlet syndrome that I had affects the vein, so it's Paget-Schroeder syndrome. And in this case, apparently, yeah, when they performed the surgery, my first rib was very thick, and my skeletal muscle was much thicker than normal, which I can imagine is probably to do with the Olympic weightlifting that I've done in the past and the year to the gym. Which, in a way, almost when they told me, I was almost proud of myself, really. But then again, that's what's caused all this trouble, so maybe I shouldn't be that proud. Anyway, feel free to ask me any questions. I'll keep on posting the videos, and I hope this can help anyone, even if it's just one person, to try to take the plunge and take the step forward and have the surgery, or even not have the surgery, depending on what the outcome of it is for me. So take care, and well, speak to you soon. Bye.